So you may have just been told that you need a deep cleaning by your dentist. But you should know that not all cleanings are the same. There's one type of cleaning that's completely free of charge with very minimal discomfort. And then there's another type of cleaning which will cost you thousands of dollars, involve multiple numbing injections, and cause irreversible damage to your gums. And what hurts me is when patients are told by dentists that they need the expensive type of cleaning when it may not be completely necessary. Some even think these cleanings are a scam that dentists do to pocket money from unsuspecting dental patients. So in this video today, we will talk about the different types of cleanings, how they are done, why they are done, and which cleaning is best for your gums and your wallet. And if you stay till the end of the video, I will give you my insider dentist secret on what the real dental cleaning scam is and how to avoid it. All right, let's jump right into it. So the two types of cleanings are regular healthy mouth cleanings and deep unhealthy mouth cleanings. A regular cleaning is typically for folks who are always on top of their oral hygiene habits and really have no gum issues. The way a dentist or hygienist performs a healthy mouth cleaning is using tools to clear plaque and tartar above the gums. This is because a healthy mouth cleaning should not have any bad bacteria under the gums. But there are several reasons why dentists would call a mouth unhealthy. First, a simple eye test is conducted by looking at the color and texture of your gums. Healthy gums are a light pink, while angry looking gums that are red or purple indicate inflammation and infection. Next, dentists will look at your x-rays to spot any buildup or signs of gum disease. This buildup or calculus looks like tiny white triangles on the x-ray. So if you're in the dentist's office, you should check for yourself if you see any. And another red flag for gum disease is bone loss around the teeth. You see here how this shadow is much lower than the gray shadow that is in the middle part of the tooth. That's bone loss, an early sign of gum disease. We also look for yellow calculus around the teeth or above the gums, which is hardened plaque on the teeth. Next, we measure the space between your gums and teeth. These are called periodontal pockets. The goal here is to shoot for 2 to 3 millimeters. But deeper pockets, especially around 5 or 6 millimeters to even up to 10 millimeters, suggest inflammation or gum disease that needs to be treated. So when is it appropriate for a dentist or hygienist to recommend a deep cleaning? If your gums are inflamed, if the pocket depths are higher, and if there's significant buildup, a deep cleaning will almost always be recommended. So let's walk through the process of how a deep cleaning is actually done, since there's a lot of misinformation out there. Firstly, remember, a deep cleaning, also known as scaling and root planing, or SRP, involves removing bad bacteria both above and below the gums. So for that reason, injectable anesthesia is often used to make the process more comfortable for you. And if you're not getting numb for these procedures, it's not a deep cleaning, because this would be extremely painful. That's an easy way to make sure you're getting what you're paying for. Then comes the cleaning part. You'll notice a lot of water being used and shot into the mouth, as the main tool, an ultrasonic water scaler, uses high pressure water and ultrasonic vibrations to remove plaque and tartar above and below the gums. Sometimes they are really stuck to your teeth, so you may feel like you're getting a high-powered car wash being operated in your mouth. And also they may use hand instruments to get a more precise control to remove bacteria in certain areas. But you may have already taken calculus in school and realized it isn't so bad. Why are these deep cleanings necessary? This is because if you are recommended for a deep cleaning, you now have periodontal disease. And this is no laughing matter. You see, periodontal disease starts when plaque, a sticky film of bacteria, builds up on your teeth. If not removed, this plaque can harden into tartar, which can irritate your gums and cause inflammation. This inflammation is known as gingivitis, which is reversible and is like the first warning sign of trouble. If this is left untreated, gingivitis can progress into periodontitis, which is irreversible and a much more serious form of gum disease. Now grab your popcorn, because this is where things start to get a little dicey. Periodontitis sometimes involves the presence of sharp subgingival calculus in your mouth for a long period of time. And since it's a foreign object, your body looks to fight it off in the only way it knows how, by running away from it. You see, this calculus has your gums and bones shrinking really fast, creating pockets where even more bacteria can hide. As the bacteria start to multiply, they can start attacking the bone and tissue that hold your teeth in place. And without treatment, this bone and tissue damage can lead to some pretty serious consequences. Your teeth will eventually start to come loose and possibly fall out. Imagine losing all your teeth one by one, like a row of dominoes falling down. But it doesn't stop there. Periodontal disease doesn't just affect your mouth, it can impact your overall health. Studies have linked gum disease to other health problems, like heart disease, diabetes, and even respiratory issues. So you may be asking, is there a way to permanently remove this gum disease and restore your gums to the health that they were when you were younger? As of today, there is no cure to gum disease. It is a chronic condition that you live with for the rest of your life. However, deep cleanings can help stop periodontal disease from getting any worse. I repeat, it cannot reverse the disease process, but it can stop the process from getting worse. During SRP, we will remove the plaque and tartar buildup from below your gum line, where regular brushing and flossing cannot reach. By getting rid of this harmful buildup, it allows your gums to heal and prevent further damage to your teeth and bone. But there is a major catch with doing scaling and root planing. After deep cleaning, you'll need regular maintenance visits every 3 to 4 months for the rest of your life to ensure your gums stay healthy. You are forever at a higher risk of buildup and gum disease from happening again. So please, take it from me, just be very careful when you decide to undergo this procedure and make sure it's absolutely necessary. And not to mention, it can be really expensive too. Let's talk numbers. Regular cleanings, also known as prophylactic cleanings, typically range between $75 to $200 per session and may even be completely covered by your insurance, allowing you to pay nothing. Now, when it comes to deep cleanings, the prices begin to skyrocket. These types of cleanings can range anywhere between $800 to $1,800 for a full mouth cleaning. Since they are more labor intensive and require more time, it is usually covered at around 50% by your insurance company. But now, here's where things start to get tricky. Some dentists may try to upsell you on a deep cleaning when you don't actually need it. This is where the potential to being scammed comes in. They might claim that you have deep pockets, or they may claim that you have signs of gum disease and you require a deep cleaning, even if your gums are pretty much healthy. Because those pocket depths can sometimes depend on how hard you push the instrument into the gums. Extreme force can turn a 3mm pocket into a 5mm pocket, requiring the need for deep cleaning. So how can you protect yourself from being taken for a ride? First and foremost, it's essential that you find a dentist that you trust. Look for someone who takes the time to explain your treatment options and doesn't pressure you into procedures that you're not completely comfortable with. Secondly, don't be afraid to ask questions. If your dentist recommends a deep cleaning, ask them to show you evidence, such as x-rays or measurements, to support their recommendation. And lastly, consider getting a second opinion if you're unsure. I'll leave a link below if you want to send me some x-rays for a free virtual consultation. But it's important to realize the necessity for deep cleaning if you have active periodontal disease. If you skip out on the deep cleaning and you end up losing all your teeth, the best treatment to replace them is called all-on-4. And this can cost up to $30,000 for each set of teeth, as in $30,000 for the top and $30,000 for the bottom, $60,000 for treatment. But if this video has been informative up until this point, I ask that you kindly hit that like button, as it supports me tremendously as a small YouTube channel. Now, as mentioned earlier, I want to talk about how I see so many patients getting scammed with deep cleanings. Lately, there has been a huge push from dentists and specifically dental corporations to do deep cleanings on patients who may not need it to generate really high profits. More specifically, dentists may now recommend applying antibiotics, also called Arrestin, to the gums to help fight off infection and promote healing. However, unlike the cleaning procedure itself, which may be partially or fully covered by insurance, these antibiotics are often elective treatments and are not included in the insurance coverage. As a result, patients are typically required to pay out of pocket for these antibiotic treatments, which can be very lucrative for a corporation focused on profits. Additionally, gum disease is a common oral health issue in these areas where these offices are placed, thereby having a steady demand for these antibiotic treatments. While they're not proven to work 100% effectively, they may provide benefits in terms of promoting healing and preventing infection. But dental patients all around the world should carefully consider whether the added expense is justified. So I hope you realize the importance of deep cleanings after watching this video. They are absolutely not a scam, but instead a vital component of comprehensive dental care. By understanding the causes and symptoms of periodontitis, the differences between the different types of cleanings, and the benefits of a deep cleaning, you can now make more informed decisions about your oral health to protect your smile for years to come. And if you don't know me, I'm Dr. Rana, and you can catch a ton of my other dental content right here on my YouTube channel if you smash that subscribe button. I look to seeing all of you in the next video. Take care, all the best.